Everyone. Welcome back to another session of A Day with your fertility specialist. I'm Joanna Damina, your host for today. Thank you for joining us. It's always lovely to have you here. We do appreciate every sort of engagement, every click, every like, every share, every comment. Today, we're going to be talking about infertility or subfertility, the differences between those two things. And I think it's very interesting because most of us out here know what infertility is, or we've heard of infertility, but may not have heard of subfertility. So we want to know a little more about that. If you're planning pregnancy this year, and if it's something that you're struggling with and you're completely confused about that, please stick around with us. We have Dr. Deborah Olivi joining us today. Welcome, ma'am.
Thank you very much, Joanna.
Yes,
Always a pleasure to be here. Good afternoon, viewers, and Happy New Year to everyone.
So, Dr. Deborah is a family physician and fertility specialist. So, I'm very sure she has a lot to, tell us about fertility and subfertility. And I'll be asking her a few questions that I hope you can resonate with. But if you do have more questions, please do well to leave it in our comment section and we will get to that. All right, so Dr. Debbie, like I said, many people have heard the word infertility, but not many would have heard of subfertility. So, what exactly are these two terms? How do they differ? Or are they even things that we can use interchangeably?
Interchangeably. All right, thank you. So, when you talk of subfertility, you're just talking about reduced or delayed ability to conceive or get pregnant.
Okay.
So, it connotes something that is not finite. Something that can change, something that is temporal. So, but when you're talking about infertility, you're talking about inability to conceive after trying for a certain period. Usually, if the woman is above the age of 35, you say after trying for a period of a year. And when we talk about trying, having regular, unprotected sexual intercourse, so you're having intercourse 3 or more times in a week. That is when we say there's adequate, coitus or intercourse, and then the woman is not getting pregnant after doing this for a year. Then we can say this woman is infertile or has infertility. That's for someone that's more than 35 years of age. For a woman that's more than 35 years of age. But if the woman is less than 35 years of age, after trying for 6 months, we say this couple has infertility. But subfertility is more subtle. Pregnancy is not happening when you expect it to happen. For people that are young, have no medical or other underlying issues, you expect, with adequate coital exposure within 2, 3 months, the
Okay.
woman should get pregnant, and then she's not getting pregnant. Some of them will quickly rush to the hospital. So when you're evaluating them at this time, and you don't want to do things that are very invasive, you do the basic minimal that you can use to know if something's actually wrong. So you do those basic minimal investigations and you don't really find anything wrong. You just say, okay, this could be subfertility. That it shows that it's something temporal. It shows that it's just a slight delay with time. A lot of them will conceive spontaneously. And
Okay.
especially when you don't really find anything, after doing that evaluation, you're not really finding anything, that could be the cause, or for them not getting
Get
pregnant.
pregnant.
Yes, you just tell them to take it easy and to keep trying. So that's where you want to use the term subfertility. So you can see that somehow, though sometimes people want to use it interchangeably. So like in the early period of investigating for infertility, you could say this client or this couple is subfertile. But when you find something definite that is causing this inability to conceive, then you can use the term infertility now because there's
Okay.
something definite to hold on to.
Yeah.
Yes.
So subfertility is something that is actually prone to change. It can
Yes.
actually be changed, but infertility is more of a finite, decisive
Yes,
thing.
there's usually a
Oh,
diagnosis, or there's usually a
yes.
cause for the infertility. Yes, sometimes with subfertility there might be causes. These causes are usually mild to moderate.
Okay.
Things like maybe infrequent ovulation, someone not ovulating regularly, and there are things that might be amenable to mild treatments for the subfertility. Maybe cancel. Some people might be because they're not meeting at the right time in the woman's menstrual cycle when she's fertile, because a woman can't get pregnant at just any time.
Anytime,
there's a period in her cycle where she's fertile, and there's a chance of getting pregnant, her fertile period. So with just simple counseling and education, you know, that could be sorted. And then for some that might have mild issues, maybe with infrequent ovulation and so on, mild some minimal drugs could also help, and they
Okay.
conceive spontaneously. But when you talk of infertility, they usually need a lot of medical treatment, for pregnancy to happen, and they might even need assisted, fertility options to be
Okay.
tried, yes, for them to get pregnant.
And you mentioned, some evaluations that have to take place for there to be a definitive diagnosis
Yes.
of infertility. So, what are some of those typical evaluations that somebody might actually have to go through?
Yes, so the evaluations are for both the man and the woman.
Okay.
So when you're still talking about a case of subfertility, it's still early, the woman is young, less than 35, and they've not tried for up to, a year. Some you can't even make that diagnosis because they're not even meeting adequately. A man in Jos and the woman living in Lagos that they hardly see. Can you
Yeah.
actually say they're subfertile or infertile when they're not even having adequate coital exposure? That's why I talked about, where did they know? Though timing has something to do with the definition, but sometimes you have to look at the peculiar situation. So this scenario, even though maybe they've been married for 2 years, but they've not actually been in the same place for the for they've not been together enough for you to have said they've actually tried. And then knowing that a woman cannot just get pregnant at any time of her menstrual cycle, there are particular times that she's fertile, then you can't actually label them with that diagnosis of maybe being subfertile or even infertile. But for someone you're evaluating for subfertility, you just do the basic. You don't want to do investigations that are very invasive. So you do basic things like wanting to do a hormonal assay. You
Okay.
want to determine if this one is actually ovulating. You want to do an ultrasound scan, a pelvic scan, to look at her uterus, to look at her ovaries, to make sure that everything looks okay. For the man, you want to do a seminal fluid analysis. You could do other screenings and metabolic analysis just to rule out other coexisting medical conditions, just ensuring that the overall health of the body is okay. So
Okay.
doing things like thyroid function tests, checking their blood sugar levels, screening for infectious diseases. So those are some of the other things you do. And if that is fine, you could tell them, go and keep trying, and
Yeah.
educate them about what adequate coital exposure is, educate them about her menstrual cycle and her fertile period. So if pregnancy doesn't happen, if she's young, within a year, between a period of 1 year, and they come back, then we can think of doing other more invasive things like doing a HSG,
Oh,
hysterosalpingogram,
okay.
to determine if the fallopian tubes are patent,
Hmm.
and then other more tests could be done,
Okay.
other more invasive things like laparoscopy could be done, depending on what you're seeing and what the history is telling you.
So
Yes,
you just don't want your clients to go through something very invasive when you're still weighing whether or not you're looking at a subfertile
exactly.
client or an
Fertile
infertile client.
client,
All right, that's
exactly.
fine. So in case you're worried about how many things you have to go through, oh, this is what you're thinking. But then again, you have that long distance relationship or marriage or whatever it is that you're trying to conceive in. You might actually need to have more information and a fertility specialist look into these things
Yeah,
for you to kind of guide you,
yeah.
a personalized guide basically as to why you are not getting pregnant. It might just be that distance, or it might just be one or two things. Like, are there some lifestyle habits, for example? I know I've heard a couple times where they say, oh, maybe it's excessive smoking, especially for
Definitely,
men like
yes.
this. They'll say
Yeah.
drinking too much sugar,
Yeah, so
things
lifestyle
like that.
contributes to
Yeah.
fertility, yes. So part of the counseling, it's about lifestyle, enforcing some lifestyle changes for women that are overweight, you know, being overweight, obese, all that affects reduces fertility. Even a
Okay.
woman that's underweight
Hmm.
can reduce fertility. So you want to counsel them so that she's in her optimal, in the normal weight limits.
Yeah.
So you counsel on lifestyle, exercise if she's overweight, the right diet. Yes, so smoking, all those smoking can impact fertility. Smoking can damage the sperm. So you
Oh.
counsel them to stop smoking.
Hmm.
You counsel alcohol should be reduced as to the barest minimum if it can be stopped. So lifestyle impacts a lot. And that's why in part of the evaluations, we don't just look at the reproductive organs alone. We do other evaluations to check for any other metabolic or other issues in the body, health
Okay.
issues, because all that can impact on fertility.
Alright, so when you have that diagnosis of infertility or subfertility, I know you've mentioned earlier that there are some treatment options that are available, and how when a person is infertile, you might have to think of some assisted fertility treatment. So,
Yes.
what are some of the treatment options that are available for a person that is subfertile versus and a person that you would say is infertile?
Okay, so for a person that is subfertile, depending on what we evaluate to be the cause, so like I said, my counseling education might just be all they need. For some, they might need some drugs to correct ovulation, to cause them to ovulate. That might be what they need, yes. But for people that are infertile, depending on the cause of the infertility, we have a whole range of causes for infertility will determine what you would do. So for some of them, it might just be some minimal forms of assisted, reproductive technique, like maybe ovulation induction,
Okay.
follicular monitoring, timed intercourse. Some could have intrauterine insemination, and then some would definitely need to have an IVF, and some IVF with ICSI being done, yes, to
Okay.
assist them get pregnant.
You spoke about ovulation with the in regards to subfertility and also with infertility.
Yes.
So is using can you also, how would I say, carry out an ovulation induction for a person that is subfertile?
Yes, you can. It
Okay.
depends on how desperate they are. It depends on their situation. I've just given you a situation where with this our modern society and the way the life and the economy is now, who's not domiciled in this. Yes, so
Yes.
that kind of thing. Yes, the best counsel might be for them to be together, meeting, having adequate coital exposure. But if that's not possible, within the constraints and the of their peculiar situation, they could have an ovulation induction.
Induction.
That could be something that could help them if the ideal situation will not be possible. Yes, so ovulation induction can be something can be done for sub
So
fertility.
fertility too. Okay, that's interesting. I'm sure that there's someone out there that might be relating to one or two things that we are saying. And I hope that this is giving you more information around this. We've spoken about infertility a lot on here. I have hosted talking about infertility a couple times. So what message would you give to someone that is struggling with infertility, or a couple that is struggling with infertility?
Yeah, so I think the first thing is to acknowledge that there's an issue. A lot of people, live in denial. Yeah, and when you don't acknowledge that there's an issue or a problem, you can't adequately face it. So it's to acknowledge that you have a problem, you have a challenge, and then I want them to know that they're not alone. Infertility affects about 10 to 15% of people worldwide.
Wow.
No area of the world is exempt from
Exempt.
this. So you can say about 1 in 6 to about 1 in 10 couples struggle with fertility at a particular time in their lives. So just know that you're not alone. There's nothing to be ashamed of or about. But I know because I know our society, is the kind of society that blames, looks down on couples struggling with infertility. But infertility is
Yes.
just like any other medical condition. It's not as if these people build it on themselves. It's not as if for some people a lot of the causes are not things that they are things that could just happen, things that have to be do with genetics, things that have to do with family. It's not as if there was something particularly they did wrong, that is the reason why they're struggling with infertility. So that is one. Don't allow anybody to project any labels onto you. Know that you're not alone, and then you seek help. The first place of help is to come for an evaluation.
Yeah.
Yes, so that we know what we need to do and how you can be helped. But if you keep hiding in the shadows or keep staying at home, not seeking help, you won't get the solutions you desire. So that's the first. And the next thing I want them to know is that there is hope. There's a lot that can be done now to help couples dealing with infertility. There's a lot that can be done. So come forward and see your fertility specialist. Come and book consultation with us. Let's evaluate you, and then we can profile all the options we have for you to you. And I know that this is a new year. In this year 2026, I know that those your fertility dreams, those dreams of having your own children, can be realized. But you need to
Yes.
come forward. The evaluation is the first step.
That's true. That's
Yeah.
true. And I mean, I have one question. as a woman, how do you think we can change this narrative that fertility is strictly a woman's problem? Because I mean, especially in the society that we're in, a
Yeah.
lot of times when infertility is a thing that couples struggle with,
Yeah.
people don't look at a
The
man.
man,
Yeah, they
yeah. The
always say,
woman
"Oh,
is
are
always,
you
yeah.
barren? What happened to you? Ah, it's been
Yeah.
9 months, it's been 2 years, it's
Yeah.
been 3 years," like
Yeah.
that.
That's
So
true.
how do we change
Yes. I
that?
think education, we just keep, like that's what we're doing with this forum.
Mm-hmm.
Just need to keep educating people. You know, about 30 to 40% of infertility is attributed to the female, and the same 30 to 40%
Mm-hmm.
causes of infertility is attributed to the man. And
Wow.
then it's just in about 15 to 20% of cases that both of them are
Hmm.
the cause. Like I said, there are a lot of causes of infertility in a
Yes.
particular couple. It might not just be one reason. There can be multiple factors responsible for their infertility.
Hmm.
So we need to change this blame game. The woman is not the sole cause
That's true.
of infertility. In the clinics, we see so many cases of a woman that was fertile, that had no issues, and the man was the focus. But because the man was shying away from this, they
Hmm.
waste 20 years, they waste 25 years,
Oh,
they
wow.
waste 16 years until this woman goes into menopause and she's not producing eggs
Oh,
again.
that's terrible.
So
Yeah.
we need to dissuade people. That's why education is important, and that's what we'll keep doing.
Mm-hmm.
Infertility is not a woman's problem alone. It's for both of the couples. And when whoever is the cause, or I mean whoever is the source of the infertility, it's still your problem as a
Together,
couple, and you should
yes.
face it as a unit,
Yeah.
not cause it, not blaming each other. When you support each other through the process, it allows the process to work better. But because we've seen that couples that are better supported, couples that are united in this journey usually get results better than
Hmm.
couples that are at each other's neck, the
Okay.
blame game going on.
Yeah.
Yeah, so the society, we need to know that it's not a woman, and we'll keep preaching it here, that infertility is not just a woman's problem, it's the couple's problem. And a lot of infertility is due to male factor
Hmm.
infertility.
Okay, well, thank you very much, Dr.
Thank you.
Debbie. That was really knowledgeable. I actually got something from that, differences between infertility and subfertility. Thank you for explaining that in a way that I'm sure our viewers are more comfortable with or have more information on the topic about. Thank you for joining us, ma'am.
Thank you very
Thank
much
you.
for having me.
So thank you guys for sticking with us. I know that this is something that we might have spoken about one or two times, infertility, but then there's that extra little bit that we added today, which was subfertility. And in case you have been in a situation that we have spoken about or Dr. Debbie has elaborated on, you might want to visit your fertility specialist just to have a better understanding of fertility journey. And if you end up with the diagnosis of infertility, like Dr. Debbie said, there is still hope. It's not the last bus stop. There's still things that can be done about it. And yes, if you're a woman out there and there's this societal pressure around you, I really hope that you feel encouraged by these live sessions and that you can actually go and get more done about it, more in your own body and with that of your significant other. This is just to encourage you because I know how difficult it can be to be a woman in this society. But, anyways, we're here for you and we love having you here with us because we love sharing these new tidbits with you. If you did enjoy this session, make sure to drop a like with us and also share for the next time, turn on your notifications on YouTube, Instagram, Facebook. We go live every Wednesdays and Thursdays by 3 p.m. So, in case you want to join us, we have a lot more coming your way this year. We can't wait to see you. Have a lovely day. Bye.